Alright Glenn, we've got your medication ready for you.
Right, thanks Frank.
Now Glenn, can you tell me about what the doctors told you about this medication already?
Yeah, apparently I've been diagnosed now with COPD.
Oh, right.
Yeah.
That's not good.
Yeah.
What are the symptoms there that you're suffering from?
Oh, really sort of coughing and shortness of breath. I get sort of quite immobile,
Right.
compared to sort of a few years ago.
Yeah. Well, with this medication that the doctors prescribe, so there's two parts here.
Yeah.
We've got the Spiriva.
Yep.
Now, the goal of the Spiriva is to make sure that we're treating the symptoms there.
Yep.
And helping to prevent them.
Yep.
COPD is a progressive disease, the doctor may have explained to you. There's no cure for it.
Yep.
But what we can do is we can look at managing the symptoms and also decreasing the progression of the disease.
Yeah, good.
Okay.
That's good.
It's a medication that you need to use every day.
Yes.
And it comes with the device that you use as an inhaler.
Okay.
So I'll show you now how to use it.
Okay, good.
That way you can get the best out of the medication.
Yeah, great.
Yeah, I think you got the hang of that.
Okay, yeah, seems easy enough. Yep.
Yeah. A lot of people don't use their devices correctly.
Oh, right.
The medication doesn't get deep into the lungs where it needs to act.
Oh,
and so
okay.
they're not treating the condition as well as they could be.
Right.
You're doing really well. I think you've got the hang of it. But yeah, if you go home and you're feeling a bit unsure, you're not quite right, come back and we can go over it.
Okay, great, thank you.
Now with your symptoms, you mentioned you got shortness of breath and coughing a bit.
Yeah.
Anything else going on? Like you wheezing at all? Your lack of energy? Anything?
Probably. Again, but both those things again come together with just this sense of immobility.
Yeah, sure,
Yep.
sure. Well, the doctors prescribed the Ventolin for you here as well.
Yes.
Now we talked about the Spiriva being preventative.
Yeah.
Now the Ventolin's going to be important to help relieve those symptoms quickly. So,
Okay.
you can have that on hand all the time.
Yeah.
I recommend that you do.
Yeah.
So that whenever you are feeling short of breath, you've got this on hand. The Ventolin's a bronchodilator, so it opens up the lung.
Yeah.
And helps you breathe easier.
Yeah.
And it works within 5 minutes, so it's really good for that quick relief.
Okay.
And that's going to help you with the shortness of breath, the wheezing, and again, more oxygen into your body.
Yeah.
It's going to mean you've got more energy.
Oh, good.
Okay, so you're going to be able to tackle those
Well,
stairs.
that's great. Yeah.
Get out and about a lot better.
Fantastic.
Okay.
Yep.
Now, again, with this Ventolin, it's a device.
Yep.
It's different to the Spiriva.
Yes.
So I'll take a minute to show you how to use it. Okay.
Alright, yeah,
That
that'd be
looks really
great.
good.
Okay.
Again, I think you got the hang of this one.
Yeah.
And like I said before, if you're having trouble using it at home, and if you get anything, come back in, we can talk about it.
Good.
But really important that we make sure we're using it correctly, getting the medication deep in line, and helping with that breathing. All right, get you back out there.
Good.
Now, I just want to cover a few things you need to be aware with side effects.
Oh, okay.
With the Spiriva,
Yes.
dry mouth can be really common.
Okay.
And constipation.
Oh,
Also
right.
stuffy nose. Alright.
Right.
And people can get muscle pain and nosebleeds as well, going back to the nose
Oh,
there.
right.
So look out for things like that.
Okay.
Alright. We want to make sure that it's not causing you too many problems.
Yeah.
Alright.
Alright.
Now with the Ventolin, it can also cause a dry mouth.
Yep.
But with some people it can cause insomnia, so keeping you awake at
Oh,
night.
okay.
Some headaches.
Yeah.
So yeah, just look out for things like that.
Alright.
Alright.
Okay.
Most people tolerate these pretty well.
Yes.
But if you see any of those, you come back in, we can chat about it.
All right.
I've got the printed information here for you, which details all the side effects.
Yep.
So have a read of it.
I will.
That'll give you a good detail to look out for.
Good. Sounds good.
Now, I'm conscious of your time.
Yeah, okay.
But just another quick thing though.
Yeah.
Did the doctor talk to you about prevention of the disease, things that you can do yourself to help make sure it doesn't progress?
Well, I think it was, to his credit, it was the doctor who really sort of, probably a year or so ago, got me to quit the fags. So I've been pretty good at that, and now that he's diagnosed with COPD, he's really stressed the importance. And I have been pretty good. I haven't been on the fags, so stressed the importance of that. But apart from that, I don't really remember anything specifically.
Well, I congratulate you first. It's really hard to give up cigarettes.
Yep.
And the biggest thing, or the most important thing that you can do to help with your disease at this stage. So keep on with that. Don't drop the ball. Really important. But there are some other things that you can do.
All right.
Making sure you're fit and healthy.
Okay.
Generally.
Yeah.
Is really important to help make sure that your body is in the best shape to be able to live with the condition.
Yeah.
So balanced diet. But also, you could talk to the doctor about an appropriate exercise program for you.
All right. Okay. Yeah.
And the other thing is, you can keep an eye on weather reports.
Oh yeah.
The air outside can get quite foggy on some days.
Yeah.
Have a lot of dust and pollen and things like that.
Oh yeah.
So keeping an eye on the weather reports on the news or online or radio can make sure that you prevent days outside where you can manage it.
Yeah.
So you're not putting undue pressure on your lungs.
Yeah.
And preventing symptoms there.
Okay. Yep. All right.
The other thing that's really important, make sure you're staying up to date with your vaccinations.
Oh yeah.
So flu vaccine's a really big one.
Yeah.
Really easy to catch the flu.
Yeah.
Year to year.
Yeah.
And you're a high risk patient now.
Yeah.
So if you do catch the flu, it can get serious really quickly.
Yeah.
And put a lot of pressure on your breathing there.
Yeah.
So really that shortness of breath can get out of hand.
Yeah. Well, I have. I must admit, frankly, I've been a bit hit and miss. Some years I do remember to get the flu jab, and some years I just let it slip. And the other one I haven't heard of.
Yeah. So pneumococcal vaccination is something you can probably talk to your doctor about.
All right.
But I think based on what you've said, we should get you booked in straight away for the flu shot.
Okay. Yeah.
Okay.
Yeah. Sure.
Make sure that
I can get that here.
Absolutely.
Okay.
Yeah,
Great.
we'll do that for you.
Great.
Before we do that, however, just also mention when you are in with the doctor again.
Yep.
Talk about a COPD action plan.
Oh, okay.
So that's going to be a plan that allows you to deal with the exacerbations and infections and things like that as they come up.
Yep.
Make sure that you're on top of things quickly.
Okay.
But also allow you to deal with the disease independently.
Yeah.
Take a bit of control back as well.
Yeah. Well, I reckon you've given me an action plan today, so that's great, Frank.
No worries. I'm happy to help, mate.
Yep.
All right. We'll look at that flu shot.
All right. Excellent. Great. Thanks for your help today, Frank.
No worries.
Great. Cheers.